So I am talking today to Michaela Spear, and Michaela runs Spear Wellbeing Clinic in Windsor, Dedworth. Hi, Michaela.
Hello, hi Emma.
And you are a reflexologist and an acupuncturist, and you do Qigong, you do lots of lovely well-being type things. So would you like to introduce yourself?
Yeah, sure. Yes, as you said, I am based in Windsor, and I am what's probably put it like in a summary as a holistic therapist. So I started with reflexologies, then I went and trained in acupuncture, traditional acupuncture, and then out of that came Qigong, which is part of Chinese medicine as well. So, and that's what I do.
Yeah, so you started off with the reflexology.
Yes, I did. Yeah.
Yes. And
So,
did you do the acupuncture with that, or did that come later?
no, that came much later.
Okay.
So I did train in reflexology. Actually, I started training in 2010.
Wow.
Yeah.
It's a long time.
Yeah. So that takes about, the initial training is about a year. And then I didn't, we moved. I didn't start straight away. That was a part of my, I was still a full-time social worker, so I did not work. And as it's always happened with reflexology, uh, I got pregnant and sort of paused a little bit, and then we moved. So I literally started to work as a reflexologist in Windsor exactly 11 years ago.
Okay.
Pretty much on the 14th of September.
Wow.
Yes.
Wow. So
Yeah,
it's almost
actually,
your
yeah.
birthday, business birthday.
Yes, it is almost, yeah.
Yeah.
4 days. Yeah, I just realized that. Yeah. It was,
Yeah.
my son was 1 or just under 1.
Yeah.
And it was 14th of September 2012.
So some people might have heard of reflexology, some people might not have. Now I have had, I think, 1 or 2 treatments of reflexology, and the first time I ever had it was actually in my second pregnancy, and it was through the midwives, which I'd never had before. And it was to bring on the labour. So what is reflexology, and who would have reflexology?
So I always say that reflexology incredibly versatile therapy. So anybody can have reflexology. There is very little contraindications to reflexology, and which is brilliant, because when I trained, 15 years ago, when I started training, there were still a lot of misconceptions and who can, who can't have reflexology, but thank goodness that was all cleared by through research or experience. So anybody can have reflexology pretty much. It also depends on who is your reflexologist and what they specialize in. So I'll pretty much treat everybody. My specialty is maternity. So I did extra training in maternity because it helped me when I was pregnant, and with fertility that helps a lot. So I did specialize a lot in that. But I also work with people in going through cancer treatment.
Okay.
And I trained in reflexology limb drainage, which was amazing experience with Sally Kay. And I just reminisced the other day because I was the first one used the RLD, or reflexology limb drainage technique, with one of the charities, local charities,
Yeah.
because I was so passionate about it.
So lymphatic drainage is
through, yeah, basically clean the lymphatic system, and often there's some swelling associated.
So it's all the fluid and everything, isn't
yeah.
it? Yeah.
So if the fluid doesn't drain properly from the body,
Yeah.
and you can do that nicely and really
And
effectively through feet.
anyone could have lymphatic drainage massage, can't they, or therapy?
Well, no.
Okay.
So massage is a different story.
Okay.
Massage is a different story. I am a massage therapist, but I don't do massages anymore. I always say with the lymphatic massage, you need to be incredibly careful.
Yeah.
Because if you have lymph nodes removed, or you had surgery like tummy tucks or similar, then the lymphatic pathways will be redirected slightly. So you really want to go to somebody who knows what they're doing.
Yeah.
And there is not many specialists, water trained, I call it, because there was the guy who set up the MLD massage.
So that's the
the
manual
lymphatic drainage massage. Yeah.
Yes.
And then you need a knowledge of the lymphatic pathway.
And I know of people who have even been on YouTube and they do it themselves.
Yeah.
And you really should go to somebody who's a professional.
If you had a surgery, if you had surgery, or you had lymph nodes removed, and obviously you're going to be sore, very sore. I always say to people, that's why I love RLD, because you can safely do lymphatic drainage with no harm done.
Yeah.
And even if the swelling is obviously the back, around the breast, when you had a breast cancer, for example, or arm, you can still do it through the feet, and you don't normally touch, unless your feet were obviously operated on, you don't do any harm.
Yeah.
And it works incredibly well. There is no need to undress. So I completely swap and stop doing the basic lymphatic drainage massages. I mean, there is a big trend at the moment of doing lymphatic drainage and with using wood therapy as well. But I don't know, I'm a little bit skeptical about that. I shouldn't really say that, but I am.
But I suppose it's a personal thing, isn't it? It's what you research and what your own experiences are.
Exactly. And it's amazing when people who are healthy and want to just move their lymphatic system and just go and experience that,
Yeah, because some people have other things going on, or they might feel like they're quite inflamed anyway. It might be due to their diet or
but lymphatic massage on its own is not a cure as such. It's a support therapy.
Yeah.
And you need to, as you said, if you're inflamed, you would need to employ, what you eat, how you eat, lots of water, and also movement. Yeah. That's why I went into Qigong, because I love my trampoline, because that's amazing. But not many people can go on a trampoline if you had an operation. So, but I still believe that lymphatic drainage should be part of every treatment if you had an operation before and after. Which and it's very popular in Germany is big on in manual lymphatic drainage. Austria, but I know it is getting more and more popular, but you need to be incredibly careful who you choose and what you choose the lymphatic massage
and
for.
Why you're having it.
Exactly, why you're having it. And if you had any compromised lymphatic system or lymph nodes removed, you need to really check what qualification the person has.
Yeah, and that's key, isn't it?
There are people like Petra, who used to be in Maidenhead, and she was a specialist when lymphatic massage therapies. There is not many of them around, so not many of them around. I know that Bray Hospice, Will Thames Hospice, has a lymphatic service, but I believe they don't do full-on support. They're more sleeves and everything. That's why I think reflexology and drainage was just amazing addition.
Yeah.
To the service and to people.
Yes.
Because I've seen how much it helped people over the years.
Yeah. So with reflexology, the one thing we haven't mentioned for those that really don't know what it is, it's where you treat the feet.
So
or hands
or face or ears.
Or ears.
Yeah. So it's
let's get back to basics. Yeah, what is reflexology? What do we do? If somebody wants a treatment, what's going on?
So in the body you have microsystems, and the microsystems can be your foot, your hand, your ear, your face. And the microsystems means normally that your whole body is mapped in that microsystem. So like you have inverted fetus like on the ear, head on your earlobe, and so on, curl up. Then you have feet, and they represent basically big toe is a head, just to be very quick. And then you got a spine on the side, and a heel is anything pelvic organs, bladder, things like that.
So it's almost like a little map, isn't it?
It's a map
if you
of
get
the
your
body.
Foot, yes, you've got, so the toe would be your head, then you'll run down your spine. So
okay. So that's why they call me microsystems. And the same is on a hand, same is on a Some people work with eyes as well. I
Oh.
mean, not as an, but there is sort of a therapy which look in your eyes and tell you. But there is also your scalp is a microsystem as well. So
Oh.
there's a lot of, so you can do acupressure or reflex on the scalp. So you got person sort of lying on your head. So you got your spine, head, and everything. The face is amazing as well. I think it's lesser known,
Yeah.
but the most known will be the feet. And each, so basically you work on those areas and they correspond with the organs. And your primary aim is to bring balance to the body.
Okay.
As a reflexologist, a qualified reflexologist, you're not allowed to diagnose
Okay.
or say you're treating an illness.
Right.
And you are working with the body's innate healing system. So you want to just a little bit of a nudge the body to heal. You're not allowed to say you're going to start a labor because that's not proven.
Yeah.
As you just said.
Yes.
So the people come to me and they said, nothing is working, for example, for labor. Can you help? I mean, ideally, you want to have reflexology all the way through the pregnancy. Actually, there is a research which say even if it's every 6 weeks, it still works.
Okay.
And your last stage of labor, it's shortened. So it's
So it is
quicker.
safe to have reflexology
Yes.
through your pregnancy?
Oh gosh, yes, yeah. So it depends, as I said, who you're working with and how qualified if you're and experienced your reflexology is. Lots of newly qualified, those who are not really interested in maternity reflexology will not work in the first trimester.
Yeah.
But I love working in the first trimester. It's because that's when people are probably the most stressed, anxious. So you just work with the person in the first trimester. When I work with my IVS clients, I just work with them through because it's a difficult time. Lots of stress, anxiety, nausea, so headaches. So you just work with whatever is needed, but you still work the whole body, and then you just work with the system which needs the most. You just pause and do a little bit more. Then in a second trimester, you continue with whatever is needed. They're getting heavier, there are more aches and pains. And in the third trimester, you then work with again whatever is needed, and then obviously preparation for labor, and that's what I call. So from 36 weeks, I always say I do preparation for labor. So when I add all the points, and because I do acupuncture, I add some acupuncture points as well. Okay. So they that's the advantage of doing both therapies. It depends what person wants, and then you can pretty much you can have reflexology all the way through. There is no, as I said, there's very little contraindications. The only one will be you always check, and hopefully your reflexology will check with you whether there is any bleeding or something unusual pain or anything you're worried about, and obviously be very much aware of the red flags, like high blood pressure, swollen ankle, swelling. That's why reflexology is brilliant for pregnant as well. It helps with swelling so much. Right. But obviously you need to put two and two together, and if the person is having headaches, blurred vision, so your red flags are adding up.
That could be
preeclampsia, for example. So you need to know. So, but it's sometimes nice because lots of women don't know. Yeah. So it's nice if you go to somebody and they say, "Oh, can you just have this check?" or say this is something is going on. So somebody else is there looking out for you
in between your. It's like that
appointments.
Sort of, yeah, it's like complimentary.
Exactly.
Medicine in between.
Yeah.
Going to traditional.
Lots of Windsor midwives are amazing. They very supportive of reflexology and often recommend people to have, even though it's last minute often, and they say, "Oh, you're 40 weeks plus and baby's still not here. Just go and see them." I mean, ideally, it would be nice if they came a little bit early. Yeah. So you can build up the appointments rather than just do one off. Yeah. So that's I always been battling with that. Because somebody called me, I was like, "Oh, can I book 3 months from now on because I'm gonna be 40 weeks?" And I was like, "Okay." Yeah. Really. And I know a lot of reflexologists, they would not take those people on because they want to build the rapport, build the, so, and the more treatments you have, the better outcome there is. You know, you can't expect that after one treatment everything is gonna be done.
Yes, which is what happened to me. Was actually my waters had gone, and they decided to do reflexology just to bring everything
sometimes
on.
so what is it about reflexology? It again, it calms the nervous system. So often when you're overdue, you're stressed, or if you haven't experienced that before. With the second one, usually the first baby, you're stressed because the due date's gone and the baby's still not here, and I'd experienced it myself. I mean, it was the longest 4 days in my life. And so the reflexology is there, and I always say to people, this is the time to relax.
Yeah.
And the more relaxed, so I put together information and the points they can do, so they come away from me with the points.
Yeah.
And they will get sort of piece of, or I'll usually email it to them, and this is what you can do yourself, and it's a combination of acupressure and reflexology points, and they can do their own acupressure and reflex points, or with their partner, because some of the points are on their feet.
Yeah.
So they can just continue and have sort of something in their hands they can focus on, because it is a stressful time. But generally, I don't promise, and nobody should promise you that the baby will come because you had reflexology. And it happened because the baby is ready.
Yeah.
And maybe you came in the right time.
Yeah.
But you can't never say that the baby would not come otherwise, So there is no research. It's very difficult to research this.
Yeah.
But yes, it calms your nervous system. So the more calmer you are, the more likely it's then baby feels safe.
So it's not just otherwise the adrenaline's going in, and that will have that negative effect.
And now, it's like they always say that if you're running from the tiger, the baby's not going to come, because your body knows it's not safe to have the baby, because the tiger would eat it.
That's a good way of looking at it, actually.
So the less adrenaline there is, the more likely it is that your body was like, and the baby said, oh, it's time to come out, because I'm ready, and my mum is ready, and she's happy to sort of welcome me, and the world is safe because she feels relaxed, So I take it like that, and I always say to people, just go for a walk, because I believe in that as well.
Yes.
So walk, soak up some sun, lots of laughter, and then just stop focusing on getting the baby out.
Yeah.
But just go with the flow, and it will come. I know it will come when you least expect it.
Definitely. So, and then do any of your clients continue with the reflexology after they've had the baby? Do you only work with pregnant ladies, or do you do reflexology with anybody?
No, it's anybody. So as I said, there can be people who are trying to get pregnant or going through IVF, and then
that's what you
specialize
in,
really. And a pregnancy, but then postnatal as well. I love reflexology limb range for postnatal, because it's like you have a wound, don't you? And lots of them have operations like C-sections. So I always recommend come and have. I mean, I have people who love their facial reflexology, so they will come for face, or they will come for feet. Often they can come with the babies, or if they manage to get the booking when somebody else is looking after the baby, then they can come with or without.
So with the face, what kind of points are we
focusing on? So again, there will be the whole body.
Okay, so just
so my treatments are combined with gua sha, so you warm up and do some lymphatic drainage as well. Do the gua sha. And so then,
for anyone that doesn't know what gua sha is, that's a tool, isn't it?
It is a tool. Actually, it is for face. Now we use crystal tools.
Yeah.
In their different shapes and sizes, but normally sort of like a heart shape.
Yeah.
And in the past, gua sha was actually a simple spoon.
Yeah.
So it was a spoon, and it was a body treatment.
Some oil.
So you normally should use need to use an oil, some kind of medium, but it is a body treatment which then was adapted to the face.
Okay.
Yeah. So the facial gua sha is very new compared to the body gua sha, but it is an old-fashioned ancient treatment.
So you're kind of sweeping the face and getting the pressure points.
Yeah, mostly sort of releasing the fascia, tight muscles, and get the flow again back on.
Yeah.
So, so I always say, obviously, with Chinese medicine perspective, you got your qi, the energy in the body and the blood,
Yeah.
and if they're stuck, then normally that's what creates the pain.
Yeah.
So your ultimate goal is to get the flow restored.
Yeah. So
So
it's very
and
holistic,
yeah,
isn't it?
it is, yeah.
So with the acupuncture, sorry,
Mm.
we say acupressure, but it's acupuncture.
Yeah, so acupressure is basically without the needles.
So doing
Yeah.
some pressure on. So
Yeah.
acupuncture is the needles.
Needles, yeah.
So this came later with you.
Yes.
So again, is this for anybody, or is this more sort of focusing on pre and postnatal?
No, I work actually with anybody,
Yeah.
pretty much. I don't do pediatric acupuncture because that's a specialist one.
Okay.
So I
adults,
don't treat children.
Yeah.
I do treat 10, 11 years old, no
Okay.
issues, because in Chinese medicine they can speak for themselves. They can tell you whether they're happy.
Yeah.
I mean, it's going to be much reduced treatment, and there can be some acupressure rather than acupuncture. I do obviously ear seeds, so I use the seed instead of.
Yeah. So ear seeds are like little tiny silver, like little balls.
Yeah, they're mostly golden, and it's golden plated, and they look really pretty. They used to be on old fashioned tape, like a surgical tape, but now they look very, very nice and
on
pretty.
A clear
look,
tape,
yeah,
so you
clear
can't.
tape,
They're just like little earrings in your ears, but they go on the points in your ears, don't they?
Yeah.
So they just sit there, and you can wear those.
You can wear them for a few days. I
Yeah.
don't recommend wearing them for too long because obviously it's a metal, so it will stain.
Yeah.
So I always ask people not to wear them more than 4 to 5 days. Yeah. But you can do them on a body point. So for the kiddies, when they're worried or anything, I can just do those.
Right.
And
so
just
all
keep
the
them
points
on.
do different things, or they affect different.
Yeah, you got points. You got main meridians, and they all hold their own points. There are other meridians. There are other theories in Chinese medicine, like 8 extraordinary vessels, and they sort of borrow points from the main 12 meridians. So you need to know. Obviously, you go to college, you learn where the points are, and that's where you work with. Each point has different functions as well. Okay. So I do work with lots of people will come because they think that acupuncture is there just for the pain, because lots of physiotherapists and osteopaths and chiropractors are using dry needling. Unless they're trained in acupuncture, it should be called dry needling because they don't know the whole system. So I had colleagues in my course who are physiotherapists, but they actually went to get the second degree in acupuncture. So they are acupuncturists and physiotherapists. But when you use normally as a physios or chiros, you get a much shorter course. So it should really, and then you learn only the specific points. I use points when the pain is, which I use as well. We call it ashi points. Okay. So it's called dry needling. But if you have a traditional acupuncturist, they work with the whole system. So if you have a pain in sciatic pain, doesn't mean that the needles will be in the area where the pain is. Okay. It will be. We often do points along the channel to clear the channel. Oh. So there is a difference. So
you can use the needles kind of almost anywhere on the body.
You can do needles anywhere in the body, pretty much, and they are everywhere around the body. There's one on the side of your eye. I don't use that very often. We use that as a difficult. We had that in a college as a difficult points to needle, and I try to probably avoid it. It's because people might not be very comfortable with me trying that.
Quite close, isn't it?
Very close. It's literally on the side of your eye, and yeah. So I try to sort of use a different point if I can.
Yeah. And again, if someone's pregnant, is that safe?
It is safe, yes. Obviously, go and find somebody who treats pregnant women. So I did, after I finished my degree, I did my postgrad in gynecology and fertility. So because I knew that's what I want to do, because that was I've been doing with reflexology. So I am trained in working with pregnant women.
But you don't
And
just work with pregnant women.
no,
You'll do that with
it's
anybody.
a major part of my work is fertility, pregnancy.
Oh, okay.
Yeah.
So before you're trying to get pregnant, you'd have the acupuncture.
Yes.
And you'd have that
That's a
again,
big
just
thing, yeah.
as a regular thing. So every couple
Yes.
of weeks.
You know, you ideally weekly.
Every week.
Yes, ideally weekly. And I think the most important time, if you ever decide to do a treatment or trying to get pregnant, is 3 months. Give yourself 3 months to 108 days, as they said. It's the life cycle of the chick.
Yep.
So give yourself some time. Don't think that you can't just. And lots of people only hear about acupuncture when they go to IVF clinic and said, "Oh, it's supposed to be really good," or some IVF clinics have their own acupuncturist, and they just start there and then. But if you can, give yourself at least 3 months.
Yeah.
That's where everything changes. Also, that's where the follicles you're going to be working with, because it takes 3 months for them to mature, 3 months for the sperm to renew. So that is a big thing about 3 months, and I try to explain to people.
Yeah.
I mean, I will work with people even if they just want to come once a month. It's not an issue. But if you really, really want to be serious,
it's the long game, isn't it?
It's just give it some time.
Yeah.
Yeah.
It doesn't happen overnight.
No, and it's changing in yourself, and it's not just. Obviously, I don't just do acupuncture. You come to me, you can have acupuncture and reflexology, but also an abdominal massage. But it's also I put together information, so more about nutrition from Chinese medicine's perspective. Chinese medicine pearls like have always your feet, have a socks on, because warm feet, warm uterus, and you need warm uterus for pregnancy. So cold uterus.
I've taken my socks off.
Yeah. No, I normally run.
I don't want any more.
I normally run around without socks, but I'm quite strict with my clients. I said no warm socks. And no ice in the drink, so supporting your stomach.
No ice. Oh, no ice in your drink.
Yes,
right.
yeah.
To keep everything
warmish.
Yeah, because Chinese medicine is. They say that it has to be kind of body temperature or
body temp. The normal body temperature. Or I always explain it as in Chinese medicine, stomach as an organ is a furnace, and if you put ice, you sort of extinguished it, and then it takes you a while to put the fire back on. You don't want the fire to be blazing, because that's obviously what in my sort of terms is sort of when you have acid reflux and things, but you have a just nice little fire going, and that helps to get sort of process the food, get all the minerals and all the goodness from the food distributed around the body and your energy. But if you're eating and drinking cold, then your stomach is struggling. How are you going to function if everything is cold?
That's interesting, because I like warm drinks.
I did since I was little. I can't stand ice, and they always look at me strangely. Even my kids, but no, I always try to ask them not to put ice. There wouldn't be ice in my house. No.
So later on, but I say later on, it's quite relatively recently you started doing Qigong.
Yeah.
So again, it's Chinese.
Yes. So you got Chinese medicine. You have pillars or parts of.
Yeah.
And you got acupuncture. So you can influence your health with different therapies. So we know all about nutrition and food. That's a big part of your health. Then we know about acupuncture as a needles, moving the chi and energy through with the needles. But then you got feng shui as well. You got how you live and environment around you.
Yeah, so the feng shui, that's a big thing in the 90s, wasn't it? They talked about it a lot, didn't they? Your house and where things are. And
but that's also part of the Chinese medicine. Then you have movement part. And I always try to explain Qigong to people. It's like we forgot that yoga is a part of Ayurvedic medicinal system, and is that it's the movement part, because without movement there is no flow in your body again. So you can influence the flow in a body, not just with needles. If you're scared of needles, there are other ways you can work. So, and Qigong is very accessible.
Yeah, and you do that with
So
for anybody, don't
yes,
you?
yeah, I mean, you can adjust it, you can adapt it, you can do it seated because it's mostly standing.
Yeah.
So I like it because with yoga, for example, I struggle with my hands, with my wrists. But with Qigong, you mostly do it standing.
Yeah.
So, which is good, you know.
And it's low impact, isn't it?
It is low impact.
You don't have to be really fit to do it.
No, I mean, definitely anybody should try at least few. So there are 3 parts in Qigong, and now will be your the physical postures, the movement, then the breath.
Yeah.
And that's another big part of what my clients don't do. They don't breathe.
Yeah.
Unfortunately, and a lot of people don't know how to breathe.
We're not taught though, are we?
Unfortunately, not lots of people don't know how to do belly breathing or abdominal breathing, which is scary in some respect. And deep breath, taking a deep breath. First thing you do, you expand your chest, but that's no, you need to expand your belly.
Yeah,
So
as you breathe in, expand out.
Yeah. So that's a big thing. So some Qigong poses you can breathe in your own way, but some that has prescribed way of breathing. So lots of breathing, and the teacher I have, he has, for example, whole course we had just on a breath. And then the third part of Qigong is visualization, again, which we don't do. So visualizing the colors, which is each element has their own colors. Visualize the how the chi moves through the body. And I always say, if somebody can't move very well because they have disability, you can just sit, do Qigong, but also you can do abdominal breathing, and also you can just visualize how everything moves in your body, because often that's the problem. Nothing moves. So your mind is incredibly powerful. So it's almost like stages. So once you start with the Qigong, you mostly focus on the postures. Then you start noticing your breath. And then the visualization is like cherry on the top of the cake. But it's, and I try to encourage, because the women I work with, mostly women I work with through my online classes, they've been working with me for a long time. So I want them to get the visualization going with more and more. Yeah.
So you are on Instagram, and do you have a YouTube channel as well?
I do have a YouTube channel.
So we can come and have a look.
Yeah, you can, but I use it mostly to put my classes on, but they are unlisted.
So we could. So if somebody's interested and they want to do an online class with you, they could sign up, can't they?
And they can sign up, but most at the moment it's sort of directly through me, not through the YouTube channel. There is a YouTube channel.
So is it like you stream it?
Yes, yeah. So we go on Zoom, but it's all recorded, and then you get a link. Yeah. It is a YouTube link, and you can go and watch it.
So then you can do it in your own time.
In your own time. So especially because not everybody is free at the same time. So it depends who is free that day. So even if I have few people sign up, lots of them just do it at the weekend when they have time.
And then you do in-person classes.
I actually do, and I've always wanted to do them a bit more regular. So I did book every month now. We got one on the 4th of October, one on the 8th of November, and one on the 6th of December. Yeah. And they're all in Windsor, in Clover.
So if somebody is local listening that is local to Berkshire, it's sort of Windsor area, Dedworth, Clover.
It is in Clover or Dedworth,
And if you're not local, then you work remotely.
Do online. I think the online works because I've got people who are not local on the courses, so it's just quite nice.
And it's flexible.
You can join from anywhere.
Yeah, and as you say, if somebody can't physically get out, it's still accessible for them as well.
I mean, you have set timings, because that helps a lot of people to have the set time. But if you really can't make it, you're not going to miss on a class. And because I try to get the Qigong to be accessible, I mean, it's £5 per class when you buy a block. So it's
That's
not,
good. Yeah.
it's I want people to enjoy the benefits, and I don't need to pay for rent for that. So that it gives me an opportunity to put a lower price on it. And then you got an hour and a half in-person workshop, and we do. So our next one, for example, will be all about immunity. So Qigong for immunity, strengthening the lungs, but also large intestine, because it's a metal element time, the autumn. So we're going in.
Yeah.
And we also do sounds, and there will be some breath work and some acupressure points as well.
You
So
do
it's
everything.
yeah, it's what works
Holistic.
with that theme on that. So strengthening your immune system, so you're all ready and going for nice healthy winter.
Perfect. So where do we find you then?
So Instagram, as you said.
So it's
Spear Wellbeing Clinic, yeah.
Spear Wellbeing Clinic
Yeah.
on Instagram and
Facebook the same.
Yep.
Yeah, so just keeping it simple. I have not branched out on TikTok, and I don't think I will.
No, keep it simple.
Yeah, so on Instagram I do post either Qigong videos or some points and helpful things and tips.
Yeah.
So it's nothing crazy. I don't do crazy
and then you've got your website as well.
And the website is spearwellbeingclinic.co.uk. So yeah, I think that's about it. That's about three.
It's three main.
It's three main. I think there is a YouTube channel, but there's not a lot of videos on it. Eventually, might be more, but yeah, that's more add-on.
Brilliant. Thank you so much for talking to me today, Michaela.
You're welcome, Mama.
Thank you.